Uniform hand hygiene. If medication is not compatible with the feeding solution, or if the patient needs to take medication on an empty stomach, stop the feeding 15 to 30 minutes before medication administration. Prepare medication for instillation into feeding tube. Check label against MAR 3 times. Fill a graduated container with 50 to 100 ml of tepid water. Crush tablets using a pill crushing device to grind pills into a fine powder. Dissolve in at least 30 ml of warm water. Identify patient using 2 identifiers and comparing these identifiers with the information on patient's identification bracelet. Ask patient to state name.
Can you state your name for me?
George Lopez.
Check name on patient's identification bracelet.
And can you state your birthday?
2/17/54.
Prepare patient by placing on high Fowler's position, if not contraindicated by patient's medical condition. Apply clean gloves. If a continuous enteric tube feeding is infusing, adjust the infusion pump to hold the tube feeding.
Mr. Lopez, I have your Cymbalta. For your depression, I'm going to put it through your NG tube, alright?
Okay.
Check placement of feeding tube by observing gastric contents and checking pH of aspirate contents. Gastric pH should be 4 or less. Check for gastric residual. Connect syringe to end of feeding tube. Then pull back slowly to aspirate gastric contents.
No gastric residual. Patient has an NJ tube. pH is 2.
Return aspirated contents to stomach. Pinch nasogastric tube and remove syringe. Draw up 30 ml of water in syringe. Reinsert tip of syringe into nasogastric tube and flush tube. Pinch tube again and remove the syringe. Remove bulb of syringe. Some nasogastric tubes are connected to a Lopez valve, which allows to stop flow of the tube to and from the patient. Reinsert syringe into tube. Administer first dose of dissolved medication by pouring into syringe. If water or medication does not flow freely, raise the height of the syringe to increase the rate of flow, or try having the patient change position slightly because the end of the feeding tube may be against the gastric mucosa. If the measures do not improve the flow, a gentle push with bulb of the syringe may facilitate flow of fluid. If only 1 dose of medication, flush with 30 ml of water after administration. When a tube feeding is not being administered, clamp the proximal end of the feeding tube and cap end of tube. When continuous tube feeding is being administered by an infusion pump, hold the feeding for an additional 30 to 60 minutes only if medications are not compatible with the feeding solution. Assist patient to a comfortable position, but keep the head of the bed elevated for 1 hour after administering the medication. Dispose of soiled supplies. Rinse graduated container and syringe with tap water. Remove and dispose gloves. And perform hand hygiene. Return within 30 minutes to evaluate patient response to medications.
Mr. Lopez, how are you feeling?
Fine.
Okay, I'm gonna start your feedings again now, okay?
Okay.